It is almost 2025. I know, I can't believe it either. And you know what that means. It's time to talk about health insurance. So in today's video, we're going to be talking about costs and things to consider, as well as discussing all of your different options for 2025. First, I want to focus on costs because, of course, when you're comparing different plans, you want to make sure you're getting the best bang for your buck. So let's talk about the different costs that you need to consider, some of which you may already be thinking about and some of which may not be as obvious. Let's start with your monthly premiums. So your monthly premium is, of course, the amount that you pay out of pocket to keep your insurance active. Now, if we're talking about a marketplace plan, then something else very important to take into consideration when thinking about monthly premiums are those premium tax credits and how they relate to your MAGI, which is Modified Adjusted Gross Income. In order to determine your eligibility for those premium tax credits, which can save you quite literally thousands of dollars per year, the marketplace is going to ask you to estimate your MAGI for the upcoming year. Now, your MAGI is very, very similar to your AGI. It can be slightly different based on certain deductions that you may take, but it's likely going to be pretty darn similar. On healthcare.gov, if you put in your zip code, it'll either take you to healthcare.gov or redirect you to your state's individual marketplace, and then it'll ask you a few simple questions to determine if you're eligible for a premium tax credit and estimate what that might be. So I highly recommend that you do click where it says start, tell you about, who's in your household. Let's put us and other people. Continue. We'll put married. I'm going to go through these as quickly as possible. Yes, we'll claim dependents. Let's say 2. Continue. Tell us about you. 35-year-old male who is a legal parent. Continue. And let's say our spouse is a 35-year-old female who is also a parent. Continue. And then let's say we've got 2 twin boys. Quite a lovely family. Okay, so this is our household. Confirm. Now we're going to estimate our income. So I want to show you this a couple different times so you see how that affects your premium tax credit. So let's say our total income is going to be $80,000. Your estimated premium tax credit is $1,104 per month. This is an estimate. Then if you were to view the plans, let's just skip this. What you will see is that premium tax credit applied and what your estimated monthly premium would be. I'm going to go back and I'm going to adjust the income that I put in. Let's put 70,000. I want to put 70,000 this time. This is why I wanted to look at this. You may be eligible for extra savings if you pick a silver plan. If this pops up for you, that you may be eligible for extra savings with the silver plan, please, please, please look at the silver plans very closely, because with these extra cost savings on deductibles, copays, and coinsurance, it very often works out that a silver plan is actually going to be a better deal for you than even a platinum plan when you actually utilize your health insurance. So take a look at that, and then we can actually sort by silver, apply filters. And you'll see you'll still have some pretty reasonably priced for a family plan, silver plans, that will offer you tremendous cost savings with those extra cost savings offered by silver plans. Now, of course, if you wanted to skip these questions or you made significantly more money, then you would see full-priced plans, which are going to be a lot more than what we were looking at before. Now remember, these premium tax credits, which are of course reflected in a discounted monthly premium, are just tax credits paid up front. So if you underestimate your income and you actually end up making too much money to qualify for a premium tax credit or to qualify for a premium tax credit of that size, then you may have to pay that back when you file your taxes. Then there is your deductible. This is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share, which are copays or coinsurance. More on that in just a minute. Of course, some services are actually covered even prior to meeting the deductible, mostly basic and preventative services or services that fall under the 10 essential benefits for ACA plans. Again, more on that in just a moment as well. Now, generally speaking, there's an inverse relationship between deductibles and premiums. Plans with higher monthly premiums tend to have lower deductibles, and plans with higher deductibles tend to have lower monthly premiums. There are even plans that can be specifically designated as high deductible health plans, or HDHPs. Then there are copays and coinsurance. So you pay your monthly premium to keep your insurance active. Once you've met your deductible, you're responsible for a copay or a coinsurance, which is the cost share. These are different though. So a copay is a fixed amount. For example, it might cost you $25 to see your regular doctor, $50 for a specialist, and $250 for the emergency room. Coinsurance is a percentage, so it could be 20%, 15%, 10%, etc. of the actual bill. So for example, if your coinsurance for the ER was 40% and the ER trip actually cost $1,000, then your coinsurance after your deductible would be $400. Another very important financial figure to take into consideration is your plan's out-of-pocket maximum. Now, all plans will have some type of out-of-pocket maximum, and this is designed to protect you from major medical bills. Basically, your plan is keeping track of how much you are spending, and should you reach this out-of-pocket maximum, which is a financial threshold, then your plan would take on the remainder of your covered in-network service bills for the remainder of the calendar year. Now, every year, the IRS sets a maximum out-of-pocket maximum for families versus individual plans, and in 2025, those numbers are $9,200 for an individual, that is to say if you have an individual plan, and $18,400 if you have a family plan. Now these numbers are actually down from 2024, which is a very good thing. You want a lower out-of-pocket maximum. So in 2024, the out-of-pocket maximum for an individual was $9,450, so that's a decrease of $250. And for a family, it was $18,900, so that's a decrease of $500. I just want to pause for a brief moment to talk about family versus individual out-of-pocket maximums, as well as family versus individual deductibles, because they basically work the same way. Basically, if you're on a family plan, you'll notice that there is a family out-of-pocket maximum and an individual out-of-pocket maximum. So if you, as an individual, independent of the rest of your family spending, meet your individual out-of-pocket maximum, then your covered in-network services would be covered for the rest of the calendar year. Conversely, let's say you don't have major medical needs, but maybe you have a couple of siblings on your plan in addition to your parents. Maybe you haven't even gone to the doctor this year, but combined, your family members have not only met their individual out-of-pocket maximums, but they've actually together met the family out-of-pocket maximum. Then even though you haven't spent at all, because your family has met that out-of-pocket maximum, then you would be covered as well, and you wouldn't have any bills for the remainder of the calendar year. It works the same way with a deductible. Now, as I mentioned, even if you choose a plan with a higher deductible, there are many services that will be provided prior to meeting that deductible. So what I want to talk about now are those 10 essential benefits. So these are the 10 essential benefits: ambulatory patient services, emergency services, any type of hospitalization, pregnancy, maternity, and newborn care. That's very important because those aren't necessarily covered by something like a short-term medical plan. Mental health and substance use disorder services. Prescription drugs, also very important, but you need to make sure that your prescription is included. Rehabilitative and habilitative services. Laboratory services. Preventative and wellness services, as well as chronic disease management. And of course, pediatric services, including oral and vision care. Now, plans can choose to offer additional benefits, but these are the 10 essential benefits that are guaranteed. Plans must also offer birth control coverage and breastfeeding coverage. And then these are other benefits that, of course, can be added, like dental, and we're going to talk about that later in the video. Now let's talk about those metal tiers, those oh so confusing metal tiers. There are bronze plans, silver plans, gold plans, and platinum plans. And despite what you may think, a platinum plan isn't necessarily higher quality than a bronze plan. These names really just have to do with the cost sharing structure. And when I say cost sharing, for these plans specifically what I'm talking about is coinsurance. So generally speaking, it breaks down that a bronze plan will have a 60-40 split, meaning your insurance carrier will pay 60% and you'll pay 40%. Silver is 70-30, gold 80-20, and platinum 90-10. Now that's just usually how it breaks down. And there are some other things to take into consideration as well. So something like a bronze level plan, because it has a higher cost share on your part, generally speaking, those have lower monthly premiums. So these types of plans might be better for somebody with more limited medical needs who's looking to save money on their monthly premiums. Also, something very, very important about silver plans. If you are eligible for premium tax credits, you may be eligible for extra savings with a silver plan. And if that's the case, if that's you, I'd highly encourage you to pay extra special attention to those silver plans, because very often with those extra savings, the cost sharing structure is actually more beneficial on a silver plan than a platinum plan. Then there are gold and platinum plans. So you will have a lower cost share and, usually speaking, a higher monthly premium. So these types of plans might be better for somebody who has more extensive medical needs. Basically, you may be paying a little bit more in your monthly premium, but significantly less when you actually have to utilize your health insurance. Earlier in the video, I mentioned HDHPs, which are high deductible health plans. These are very important because very often they are offered in conjunction with an HSA, which is a health savings account. This is a money saving tool as well as a wealth building tool, which is very, very popular within the FIRE community, financial independence, retire early. Now, every year, the IRS sets a minimum deductible in order for a plan to be considered a high deductible. And in 2025, that minimum deductible is $1,650 for someone who's on an individual plan, and that is a $50 increase. Now, if you're on a family plan, the minimum deductible in order to be considered a high deductible health plan is $3,300, which is up $100 from 2024. But of course, it tends to be on the higher side and can actually go all the way up to the out-of-pocket maximum for 2025. As we've discussed, plans with higher deductibles tend to be better for people with more limited medical needs. On the flip side, if you're someone with extreme medical needs and you know you're going to meet that deductible or even your out-of-pocket maximum extremely quickly, then you could still consider a high deductible health plan. HSAs are the main draw though here. HSAs offer a triple tax advantage. So the money that you contribute to your HSA, which is your account with your money in it, is actually pre-tax, therefore lowering your taxable income. Not only does it lower your AGI, but of course it lowers your MHEI, and therefore it could actually push you into a lower tax bracket, making you eligible for a larger premium tax credit. Now, HSAs themselves, the accounts themselves, are actually interest bearing, and that interest is also not taxable, and that money will roll over from year to year. You can withdraw the funds for a qualified medical expense, and the list is truly extremely long. And as long as you withdraw the funds for a qualified medical expense, then there is no taxation or penalty. But you don't have to withdraw it. You can let it roll over from year to year. Again, it is accruing interest. And if you hold on to it until you're 65, then you can use it as you would a basic retirement account. And there's one more major benefit to HSAs, which is that you can actually invest a certain portion of it, and the earnings on those investments are, again, not taxed. Now, on the marketplace, you will likely see HMOs and EPOs. It's highly unlikely that you'll see PPOs, but you might. However, it's very important that you understand the differences between the three. A brief pause here. If you like what you're seeing, and we hope you do, please make sure to click like and subscribe as well to stay up to date. Now, if you have any questions about your health insurance, you can reach us in the comments below or at the number on the screen. We are licensed nationwide, and there's absolutely no charge for our services. So if you want somebody to sort of take the guesswork out of enrollment for 2025, please feel free to give us a call. All right, let's get back to it. So basically we have HMOs on one end of the spectrum and PPOs on the other, with EPOs somewhere in between. So with an HMO, you will only have in-network coverage. With a PPO, you have in and out-of-network coverage. With an EPO, you only have in-network coverage. Now with EPOs and HMOs on the marketplace, the exception, of course, is in the case of a true medical emergency. With an HMO, you need a PCP, which is a primary care physician. For a PPO, you don't need a PCP. For an HMO, you need a referral for a specialist. You don't need that with an EPO or with a PPO. And then, of course, HMOs tend to have lower monthly premiums, with PPOs being on the higher end of the spectrum and EPOs being somewhere in between. So now that you have a pretty good understanding of the ins and outs of marketplace plans, let's take a look at the actual plans themselves. So we can finally preview health insurance plans on healthcare.gov. Now, of course, if your state does not use healthcare.gov, when you put in your zip code, it will prompt you to go to your state's individual marketplace website. So let's put in some information. We're going to skip this. All right, let's say it is us and other people. We'll put that we are married and that we have 2 dependents. Let's say we are a 35-year-old male who is the legal parent of a child, married to a 35-year-old female who is also the legal parent of a child. And one of our children is 2. And one of our children is 5. You confirm all of your household information is correct and move right along. And we will estimate our income. Let's say we estimate our income at $75,000. Remember, that is the total household income. That's not just your income as the person who is looking at the plans. Continue. So, based on the information that we have put in, it's estimated that we will receive a premium tax credit of $1,339 per month. So when you view the plans, you will see that discount applied. Also, based on the information that I put in, you'll see you may be eligible for extra savings if you pick a silver plan. And this is a great thing. Basically, as I said earlier, those silver plans have a 70-30 coinsurance split. However, if you're eligible for extra savings, then very often your coinsurance is even lower on a silver plan. And as you can see here, there's extra savings on costs like deductibles, copays, and coinsurance. So if you are eligible for extra savings with a silver plan, I highly encourage you to give those silver plans a little extra attention. View plans. This is just the pop-up that shows you how to use the website, basically. I'm just going to click out of this. So right now it is filtering based on lowest premium. You can, of course, filter by lowest deductible if you need that instead. Right now we're looking at health plans. If you needed dental plans, you would go here. Now let's look at the filters. So monthly premium range. Let's say that you can only spend for your family $500. Now let's say we really want to look at these silver plans. Anything else that we want to put in? Now, if you know that you need an EPO, there are some PPOs available. How wonderful is that? But let's say you definitely know that you need the flexibility of an EPO because you don't want to need a referral to see a specialist. Anything else, if you know that the doctor that you already see or the hospital that you use only takes certain insurance plans, then you would make sure to apply that as well. Now, if you're really, really interested in an HSA, if that's something that really appeals for you, you would click eligible for an HSA. And then, of course, medical providers, if you already have your doctors that you see, make sure you click that there as well, so that way you can make sure that your doctor accepts this plan. And for prescription drugs, you would, of course, do the same. So let's apply these filters and see what we come up with. So now we're down to 13 plans. Let's take a look. So we've got this one, the premiums come in at $265.62 with a $9,500 deductible and an out-of-pocket maximum, the family total of $14,700. Now, when you click View Full Details, you will see more information in just a moment. Let's see what else we have. Okay, another Oscar. And of course, the plans that we're looking at are going to be pretty similar right now because of all the filters that I've applied. But this is basically going to be a brief snapshot of some of the important information, like how much you pay for your primary care versus a specialist versus an urgent care, 40% coinsurance after your deductible. Ooh, for the emergency room. That's pretty expensive, not going to lie. This one, $40 for primary care, 60% after deductible. Now let's say these 3 plans were of interest to us. We would click Compare Plans right here. And then you compare those 3 plans. Usually you can compare up to 3 plans. So let's take a look. So our monthly premiums, they're pretty comparable in all honesty. You can see that $1,339 tax credit was applied. This plan has the lowest deductible for individuals and for families, which is certainly very helpful. Let's see. And this is Silver Classic Standard. Scroll on down. Plan documents. This is where you'd find your summary of benefits. Very important. Costs for medical care. All right, let's take a look. So we're only going to see in-network coverage because this is an EPO. Let's take a look at some of these costs. So the deductible we've already discussed. Over here, out-of-pocket maximum, $6,400 for an individual, $12,800 for a family. So this is also the lowest. Primary care, $10 from day one, $40 from day one. The reason it's telling you from day one is meaning you don't have to meet your deductible prior to having access to your primary care physician, your PCP. Specialist visits also covered from day one. X-rays and diagnostic, 40% coinsurance after deductible. Laboratory outpatient, $10, 40% coinsurance after deductible. So that's a big difference here. That's a very big difference here. Basically, we're looking at $10, and this one's the deductible plus 40%. Huge difference. Outpatient facility, all comparable. Outpatient professional services, all comparable. Hearing aids are almost never covered. Routine eye exam, not covered. Eye exam for children, covered. Eyeglasses for children, covered. None of these offer an HSA prescription, so we're going to see the tiers here. And so we didn't put any prescription medications in, but if you do take prescription medications, please make sure to put that in. That's very important when comparing plans. Many plans break them down into these tiers, generic drugs being the least expensive, with usually specialty drugs being the most expensive. Then you can view the list of covered drugs here. Offers mail order pharmacy for a 3-month supply. Prescription drug deductible is included in the plan deductible. Sometimes there can be a separate deductible. Access to hospitals and doctors. This is just saying that it's not a PPO. Urgent care and hospital services. This is breaking down those costs a little further, although we did sort of already go over those costs. These are always the same examples, which is the typical cost for a healthy pregnancy, typical cost for managing type 2 diabetes, and typical cost for a treatment of a simple fracture. Now, this isn't necessarily the most helpful, especially not this typical cost or treatment of a simple fracture. It's not like you're planning on that happening. But if you are pregnant or planning on becoming pregnant, then this is actually very helpful. If you do, in fact, have type 2 diabetes, this is very helpful. So this isn't going to help you in multiple situations, basically just these 3 situations, but it's just a brief snapshot that shows you what the cost might be for these types of circumstances. We already know that the dental is not covered for adults. Any medical management programs, you can find those here. Now, if I wanted to really investigate one of these plans more thoroughly, let's say I wanted to investigate this plan more thoroughly, what you would want to do is go over here where it says Summary of Benefits. And this is a more thorough breakdown of the benefits offered and the costs associated. Let's go back to the plans. We're going to get rid of these filters that we have applied. So now we're back to 178 plans. 64 of those had extra savings. Let's say that you really, really wanted a plan that was eligible for an HSA. Let's apply that one filter. So now we've dropped down to just 2 plans, one at $450 and one at $1,039.72. It's a significant difference. Whoa, but this is 5% after you've met your deductible. Yeah, so you have to meet your deductible for basically everything. Just looking at these, briefly, I gotta be honest, they don't seem like great plans. The premium is still, well, certainly not this one. It's very expensive. The premium is a little bit higher. The deductible and out-of-pocket maximum are, of course, much higher, as I said they would likely be. Let me just look at these plan details. Actually, yeah, let's go to the plan details and take a look. Deductible, costs for medical care. Yeah, basically to do anything except for some of those more, some of the preventative services offered under the 10 essential benefits. Basically for anything, you're first going to have to meet that deductible of $6,650, which is pretty significant. Now, of course, you can contribute a significant amount to your HSA, and perhaps that's something that's very, very important to you. But in my estimation, it seems like somebody that is looking in this type of plan, this one specifically with those much higher deductibles, very few services covered prior to meeting the deductible, this seems like somebody who's really using their insurance as an investment tool and a wealth building tool rather than primarily to cover their health concerns. So this type of plan with this very, very high deductible and very few services covered prior to meeting the deductible, this would really be good for someone who is looking for wealth management tools and who has minimal health concerns. Because if you're somebody that does have regular health concerns, this plan is going to end up costing you a lot of money. Let's get rid of this. I also want to take a look at the PPOs, since as we've discovered, there are a few PPOs available. That is very unusual, so that's really nice to see. That gives you so much more flexibility. Of course, as I mentioned earlier, PPOs tend to have higher monthly premiums, and that's exactly what we're seeing already, that these premiums are much higher than the ones that we were looking at even when we were just looking at EPOs. That being said, it's going to provide you coverage out of network as well. So if you need to go out of network, even if you know right now that there are no EPOs that offer you a provider that you need to see that is in network, then a PPO is the better way to go, because even though this premium is higher, yes, you're not going to have to pay the full cost out of network, which you would have to do with an EPO. Now, you may or may not have noticed that some of the plans in the marketplace offer dental coverage. And I just want to caution you here, because sometimes those networks for dental plans can be rather restrictive, especially if we're talking about a DHMO. And private dental insurance can actually be very, very inexpensive. So if you do want to learn more about your dental insurance options, I'd highly recommend you check out this video over here. Also, if you want to learn more about marketplace plans, make sure to check out our full playlist. As always, if you have any questions, you can reach us at the number on the screen or in the comments below, and please make sure to like and subscribe. We'll see you next time.